What else do you think the reason why mental health should be funded?
See, mental health is part of our overall health. Okay.
Yes.
Yeah. The WHO does not define health and they remove mental health. Okay. It is a general well-being. Okay. Physically, mentally, psychologically.
So if my body is okay and I disturb psychologically, I'm not healthy. So welcome to Mental Health and Science with Enock Francis. Today we want to talk about why mental health should be funded. In our previous video, we talked about why mental health is neglected. So if you are still new to this channel, we request you to subscribe because that motivates us to make more videos for you. So today I am having Mr. Joel, who is a medical clinical officer. We are here to discuss mental health matters. Okay, so stay tuned until the end. Yeah. Why do you think mental health should be funded?
Firstly, the population of people that have mental health in Uganda and globally is very big. So that is to say mental health is very common. Okay, it is a common condition. We have people with depression, anxiety, people having mood swings, bipolar disorders, and we have schizophrenia everywhere almost. Okay,
there is also substance abuse.
Substance abuse, very common. Okay, now globally we find that 1 in 7 people have at least suffer the consequences of what, or they will experience mental health in their lifetime. Okay, and that is close to 1 billion people. Now this is on the rise. Imagine, it is not something that a stat that is going to stop there. It is rising. In Uganda today, we have like 1 in 3 people have what, experience mental conditions in their lifetime.
Actually, in Uganda, they say that around 14 million Ugandans have mental illness. But most of these people don't know whether they have mental illness.
14 million? Now, what is even more tragic is that out of those, in 10 mental health cases, fewer than 1 of them get the attention.
Okay.
Yeah, fewer than 1 in 10 get the mental health services they require.
Actually, it is very alarming because if you have 1 in every 3 people, which is around 32% of the Ugandans having mental illness, is alarming. Because when I'm going to the facility where I work from, like the road can be around maybe, let's say, 10 kilometers.
Yeah.
But before I reach the clinic, at least I have seen 3 people. I meet at least 3 people with mental illness, and these people are not on treatment. And I'm asking myself, why can't they bring for me these people? I manage them and they become productive.
Moreover, even if they brought to you at your facility, you will not be able to give them the right medications because the supplies are not there actually. Okay, and we're saying that mental health is not a concern for only the privileged. Okay, it is a global thing, and anyone can have mental illness.
Okay.
Yeah.
So what else? Reason number 2, why should mental health be funded?
Now, first of all, we're just talking about how big a number of mental illnesses we have today. We're talking about congestion. Okay, you go to hospitals, go to facilities, and see how many people will be attended to by one psychiatric clinical officer, or say maybe a specialist at Butabika. Okay, so there is a lot of congestion. Now they are going to get burnout. We're talking about people; these are not robots. Okay, so we don't have very big numbers of specialists. They're going to get burnout. They need help. Okay, so mental health as a whole, the government needs to come in. Okay, probably fund training of more clinical psychiatric clinical officers who are going to help at least reduce the the stress there, so we can save our health workers.
Okay,
we're going to see productivity. Okay,
yeah. When you talk about productivity, what are you trying to say? Like
now this is basically about the economy. Okay. Yeah. Now the Ugandan economy is dropping slowly because of productivity. Okay. One's ability to reason and build something that is going to help them, help the country. Okay. Yeah.
Help the country to grow.
Help the country to grow economically. Now, when someone is having mental health, is not going to be able to concentrate for a long time. He's going to start absenting themselves from work. Okay, we're not going to have budgets made very well. I don't know. We might be having some people with mental health even in the parliament. People who need mental attention even in the parliament.
So in other words, saying that when someone has mental illness, it affects their productivity. They are not able to make a contribution to their community.
Very well.
Like someone has a family, is not unable to take care of their family.
Very well.
Okay.
Yeah.
So that is really wonderful.
Family instabilities come in there. Yeah. And now the whole country as a whole, because it starts in a family and then the community and then we find in the district and then in the whole country and then worldwide.
Then there is this one whereby like mental illness can lead to serious consequences. I don't know whether you have heard, recently we have heard of people who are highly educated committing suicide. Okay?
Yeah.
So these people, they're having issues which are disturbing them. They need support, but because we have few professionals who can help them out, so they end up ending their lives. So they can have serious consequences,
serious
like
suicide come in there.
Yeah, I've heard in the developed countries where someone comes with a gun and starts shooting the whole school, even the teachers maybe of chemistry who was disturbing him says, "Now why are you disturbing me?"
So we're getting innocent lives lost for no reason. Okay, yet we could prevent this by giving these people attention, medical attention. Okay, yeah. Now, not only suicide, or maybe it could be suicide bombing as well. But then there is also within families. I mean, we have mothers, okay, who also have mental conditions. These mothers can end up killing the babies. Okay,
there is one who could walk with the child the whole day. The child is not eating. The child is just 10 years, but is moving the child the whole town, and
so we're not talking about just something that is slightly a problem here. This is a big concern. It's a very big concern. We want to save lives of mothers, of our youths, our adults, the parents, and we want to stabilize the whole society. Yeah, so the consequences are very big, like you have said.
So again, what other reason number 4? What do you think could like why mental health should be funded? I know there are some people who are outside there who are listening to us, and they wish to support us, and we invite you. If you are a well-wisher, you are a policymaker, you are a donor, and you want to support mental health, we request you or we invite you to come and partner with us so that we can offer mental health services to our communities here in Uganda. Also in the refugee settlement, they don't have a mental health clinician, so people are taking wrong medicines. You find someone of epilepsy is taking chlorpromazine. These are medicines which are contraindicated in their condition. They worsen epilepsy. So, but if you support, they need medication, they need to facilitate those mental health outreaches, they need drugs, they need people to like social support. If you have counselors, social workers who can offer these services, then we shall have a health community. So, what else do you think the reason why mental health should be funded?
See, mental health is part of our overall health. Okay. The WHO does not define health and remove mental health. Okay. It is a general well-being. Okay. Physically, mentally, psychologically.
So if my body is okay and I disturb psychologically, I'm not healthy.
So what he's trying to say is, okay, when someone has a mental disorder, okay, definitely they may not even be able to take care of their physical physical health. Yeah, and that's why we're going to have people are going to start skipping their meds for hypertension, skipping their medicines for diabetes. Okay, what is going to happen? We're going to end up losing lives. People are going to develop heart failure, kidney failure, just because we did not start with the core. Okay, yeah, the mental health.
Yeah, I heard this one who was visited the facility and one was not taking their HIV drugs.
Look,
so it affects their overall health.
It affects.
Okay.
It affects.
Yeah. So as we are about to finish our discussion, one last thing is that early treatment saves money. Okay. If we admit these people early to the hospital, it saves us a lot of money, because you remember when we admit you in the hospital for long, you pay medical bills. Okay. Yeah. So we are saying that when we fund mental health, people get treatment early, and we spend less time in hospitals, because our relatives are admitted, and this is why mental health should be what? Should be funded.
And also, my heart is with the youths. Okay. Yeah, the youths are the ones rising, and the whole country, the whole world actually depends on the youths. Okay. If they do not have a sober mind, if they don't have that good mental health, they are not going to be able to take charge, take responsibility of themselves and also of the whole world, the whole country. Okay?
So as we are concluding, which message do you have to tell our government, our policymakers, and maybe other people who are willing to support us?
If you're out there and you're watching, mental health is not a disease, is not a problem for the privileged. Anyone is part of this, okay? And it's not a few that are going to suffer the consequences. It may not be you today, may not be in your family today, maybe that the next day, okay? Now, policymakers, you're drawing the plans, you're drawing the budget, but maybe you are partly forgetting about mental health. We need to help people with mental conditions, and we do this through increasing the funds, okay? 1, in the facilities. 2, also to train other mental health experts so that we can reduce the burnout in the fraternity of mental health. And globally, okay? Globally, funders, NGOs, support organizations, let's not look at only the physical conditions. HIV, blah, blah, blah. Malaria, blah, blah, blah.
Malaria to 0 days to malaria.
Yeah. We're getting nowadays immunization, vaccinations for malaria. We cannot get one for mental health. Okay?
You cannot be immunized.
So, hey, let us embrace this as a whole. Okay?
So worldwide, it is the total health budget. Most of the countries invest on average 2%. 2%. So I was asking myself, where does the 98 go? So we are requesting that at least increase the percentage. I don't know.
Now for us in Uganda, it's less than 1%.
Less than 1%.
Please increase to at least 5%. Yeah, that can help. 5% of the health budget. That can help us, okay? Yeah, that can save many. Yeah.
Which other point can you give to those people who are watching us?
Let us also incorporate mental health services in the PHC, okay? We go for primary health care. There's no day you're going to hear that there is also going to be mental health services in the primary health care. When we go out there, okay? So if we incorporate this also, so that when we go out, we're going to maternal health, do this. We also go for mental health.
Okay.
Yeah, for mental health.
So thank you so much for watching. If you are still new to this channel, I request you to subscribe, because this motivates us to make more content for you. And we are inviting you to partner with us so that we can offer mental health services to places where they are needed. We are saying that in the refugee settlement, these people are not having psychiatric clinical officers who can prescribe for them the right medication, people who can give them the psychotherapy that they need. So we are inviting you to come and partner with us. Our numbers are there on YouTube. You can get in touch with us and we shall be happy. Thank you so much. See you in our next video.